Morning everybody, I'm Mear, I'm Chief Exec of the Academic Health Science Network for North West Coast, which for people who haven't been to these meetings before, North West Coast is Cheshire, Merseyside, South Cumbria and Lancashire. And we're very proud to be part of the European Connected Healthcare Alliance and to be running these meetings on a quarterly basis. So we'll just go through some housekeeping. So you can see on the screen, toilets are just out there by reception, no fire alarm test planned. We've got lifts for evacuation, east and west stands of a venue, and we congregate in the car park. So there's quite a lot of staff from the stadium around, so I'm sure they'll lead us to that place if we need to. We'd like to thank all our exhibitors. We've got some fantastic exhibitors around the room, and our theme today is self-management and personalised care. So you'll see like some of their products and some of the things they're working on really support that agenda. So do take a look at what they've got to offer. And if you notice on your badges, you've got a little blob, different colours. Green means that people are from healthcare, so if you want to sort of search out healthcare, people look for a green blob. Yellow means they're from industry, and red means our academic partners. So hopefully, if you forget it's on this table here, you can have a look and just search people out that you want to talk to. So what have we been doing in our ecosystem so far? We've been covering lots of different topics, and it's been sort of quite a natural progression. So for people that were here at the last meeting, we had a focus on integration, and we had a lot of speakers talking about integrated care, how you can make that work. And integrated care really underpins self-management approaches. So how can we personalise care for each person that we serve, and how can we do that well across a system? So we've been building up a theme and using all the partners in the European Connected Healthcare Alliance to help us think about how we might do things differently, how we might use their experience, and how we might move things forward in our region together. So Brian's going to tell us a bit more about the ECH Alliance, but really good partnership for us, and he's going to also talk to us about China. So I was going to take this opportunity just to think about what self-management and person-centred care is, but also to think about how it fits with the AHSN agenda, because we've just been planning our business plan, so I was going to pinch a bit of your time to talk about that and think about how we might progress that together over the next few months. So I was just looking on the web for what our people, citizens, residents, patients, whatever we want to call them, think about person-centred care. And there's some really nice stuff from National Voices talking about how important this is to the people we serve. So the first thing that I was looking at that I thought really stood out was what are the principles of person-centred care? So what we'll be looking at to support somebody with managing their own care. So we talked about it being about their dignity, respecting them as adults, and compassion. Not everybody's wanting to travel into hospitals and primary care centres. They want to manage care and be in control of their own destiny. Every individual encounter matters, and can we coordinate services around people so they can self-care? Can we set ourselves up so we're really focusing on the people and not the institutions? Can care be personalised and tailored to their needs? And personalising care and self-management is actually about enabling people and empowering them to look after themselves. And one of the studies that looked at what actual people across the system want to do, it talked about 82% with a long-term condition already play a role in their care, because they're bound to do, because they're dealing with it most of the time. But actually, more than 90% of them said, we want to do more, we feel like we can do more, we know ourselves, our conditions, we want to look at that. 75% of them said they might need some guidance from a healthcare professional, but actually, if there was a peer who was self-managing, that would do as well. Somebody who could tell them how to manage their conditions, somebody who could talk them through it, so that they actually could take control and care of their own health. And there was something on from a patient that was really sad, that said, as soon as I got a diagnosis, it was like I stopped functioning as an adult. Everything was done for me. Nobody thought I could do anything myself. It was like having power taken away from me. And we all know that we've got lots of people with long-term conditions. There's 15 million people in the UK living with a long-term condition, and that is going to increase. So we really need to start focusing on this and empowering people to look at their own health. And one example that's particularly pertinent to me, I'm going to talk a bit about the work we've done on stroke and atrial fibrillation. And my husband's had atrial fibrillation for a long time. And actually, I didn't realise how serious it was until we started doing some of the work at how serious it could be. And then I thought, oh dear, I better take a bit more notice of this. So he's been on warfarin and anticoagulation for a long time. And because of the work we've been doing and some of the companies we've been working with were saying to me, oh, you should be able to manage this yourself. He goes into the warfarin clinic every couple of weeks. If he's not stable, he's going in every week. He has to sit down and wait. And it's a really long process for just an easy outcome. So we looked into buying a self-monitoring machine. So the CCG said, yes, you can do that. We'll allow you to self-monitor, but you will have to buy the machine yourself. So we looked into it, fairly expensive. The company who produced it said, oh, you can pay on a direct debit every month. So we could do that. Not everybody would be able to. So the CCG would provide the strips that he needed for testing and the other products. And so he went in to have his session to show him how to use the machine. He had to sign loads and loads of paperwork to say that he was responsible for managing his condition, which he is anyway. So he had to sign all the paperwork. He had to bring things home to read. He wasn't allowed to just hand it in. He had to bring it home and sign it off. So he can now self-monitor. So he uses the machine, but then he has to ring into the practice nurse or the anticoagulation nurse with his figure of what he's got from the machine, and then she then rings him back and tells him what dose of warfarin to take. And he was very happy with that as a patient, and my response as somebody who works with this is that actually isn't self-monitoring. What she will do is put that into a formula and then ring you back and tell you what warfarin dose you should take, when actually as an adult you can do that yourself. If you had an app, if you had the formula, proper self-monitoring is doing that yourself. So some of our colleagues are working on an app to look at this, so he will be trialling it to see how that works. When he rings in, does he get the same figure when he does it himself? But I suppose part of this for us as professionals, if we're in the NHS, is can we allow people to manage their own health? Do we feel like we can empower them? And also for industry, academia working on these, like with their sort of massive research brains, can we create that system so people can actually truly self-monitor? So from personal experience, what should have been something very easy for somebody who was very capable and has had a condition for a long time, it was very difficult and is very difficult to get to where, as a resident and a citizen and an adult, this needs to be. So I'm really interested today to hear from some of our speakers how they have managed that, and from some of our GP colleagues who are speaking, how they can empower people. So I'll just go through our business plan and a bit about why we think self-management is so important and how we're going to support that. So people will know that as an academic health science network, we have tried to engage as many partners as we can in this agenda. Really important for us to get everybody around the table to be thinking about how we improve care for residents. And obviously why we do this work with the European Connected Healthcare Alliance, because that gives us access to partners right across Europe and their ideas and their good practice. And they look at our good practice and we can export that and get our region on the map. So we've been building up our values over the last year, thinking about how we want to be as an AHSN. And part of that is about thinking space, working with partners to think about how we change things, but also co-creation. So if we work together to think about things, co-create it, can we co-design it, can we co-resource it and bring funds in so that we can actually make a difference together in moving these things forward. So in 14-15, we have concentrators on a number of clinical areas, and we've been really successful. We have a small staff base, and they have all worked so hard and really achieved lots of things over the last year. And we were looking back at things we concentrated on, and I've talked about AF from a personal context, but we've run an AF identification campaign. So if people know that they've got AF, can we help them and support them in stopping them having a stroke? Can they get the right treatment? And Julia, who's here somewhere, Julia Reynolds, Julia's been leading that campaign, so if anybody wants to talk to her about that. And Julia's done really good work across Liverpool, and it's rolling out into Lancs this year, in using the resources we've got in community, like football clubs, charities, to reach out to people and to get them tested for AF. We've worked with some products, a LifeCore over there, we've worked with their products in GP surgery, so GPs can test really quickly, and the process becomes very smooth. We then combined that with one of our other pathways, which is medicines optimisation, to look at what prescribing GPs could do differently, nice prescribing, to make sure that people are treated properly. And we think that as a result of that, we identified 15 people with AF, so that's just across one of our regions, and the anticoagulation prescribing, changing that, can potentially stop 19 strokes. The identification of the AF cases could stop 15 strokes. So that's a number of lives that have been changed. And also in terms of money for the health economy, that's £500,000 that we can spend on other things. So we're trying to quantify our impact in what does that mean for people's lives, for carers, for them being in work, and what does it mean in money terms actually across the health economy. So that's a campaign we'll carry on into this year, and Julie's now concentrating on Lancashire. I think you've got Bill Bowman coming up to launch it in Lancashire, and we'll work again with the sports clubs in Lancashire to get people in and think about how we use those community assets. Our medicines optimisation programme, that's one part of it, that will continue, and every single AHSN in the country is looking at how we get the right medicines in the right dose to the right people at the right time. So that's what sits behind it. And the Alliance have been really instrumental in that, in introducing us to international partners in the Netherlands, and a big medicines optimisation programme we have in Northern Ireland that's helping us to move that forward very quickly. So close to a lot of your hearts in the room, we've had a digital health campaign that Liz Ashell-Payne has led, and Liz is here somewhere, I've seen her. Oh, so Liz is at the back there, and Liz is now working for the European Connected Healthcare Alliance, so congratulations, Liz. And Liz has been running that campaign for us, and we've realised that that is so important. We want to have it as a bedrock that fits under all our campaigns. So digital health will be part of everything we do. We will look at how we can deliver things through digital means, through self-management in every campaign. And Tony over here, so Tony Schaffel. Tony works at the moment in the Lancashire People Record Exchange Service, and Tony and his colleague Declan are going to be working with us 1 day a week each to look at how we do that. And Tony's very technically able. Tony, you know all the terms, you know how it works. So we're hoping that we can start to move that forward. So this, I should have put this slide up actually. So these are our campaigns that are running forward into this year. You'll see some that have changed. We've actually, some campaigns that we thought were really valuable but we weren't getting much traction with. So we want to deliver results to people. So we've rationalised slightly. There's one extra on up there which is about reducing alcohol-related admissions to A&E. But all the things that you see on the screen are part of what we feel has been successful in this year, areas that we can work in partnership. We've built up really strong collaborations so that we can roll those out across the region. And you'll see that we've got some safety campaigns, and we've classified things in this way for NHS England purposes, because obviously patient safety is very important after some of the failings we've seen in the NHS. And we've got some cross-cutting work streams, not just digital, quite a few others, and you'll see that resident involvement is one of those up there. So how can we involve people to be instrumental in shaping the campaign, so co-designing with us, and we've just brought a firm in to look at our strategy of how we deal with people, how we pull them into the campaigns. Because over the last year we've done that through some of our health watch bodies, but we want to make that even further embedded. So that will come out to you. We can send the slides out to everybody so you can see what our focus will be over the next year. We haven't increased our staffing, and we've sent this out to wide comment, and people have said, gosh, this is quite a challenging programme, but we've set objectives that we think are achievable, but achievable working in partnership. So it's not all down to us, it's down to us working with you to achieve this. So this is just, when this comes out, this is what we're obliged to do for NHS England. They put a lot of funding into the region, and what we try and do is get a good return of investment on that funding and support them in what they need to achieve for patients across the country. So we have some key partnerships. Obviously I've talked about the European Connected Healthcare Alliance. We have some clinical networks in our region who we work with very closely, and their staff have all got a clinical background and they help us to get some clinical input that's robust and evidence-based into the work we're doing. And going forward in this year we'll be working even more closely. We're aligning our work plans to make sure that we focus on the same things. And I think Julia and her colleague Jill, who's in the room, they've been working with the SCN over the last year on their precision medicine and stroke campaigns. So international partnerships, obviously European Connected Healthcare Alliance, that we've now got the China Connected Healthcare Alliance that Brian's going to talk to us about. So plenty of opportunities in new markets for businesses, for our excellent healthcare services, for training staff, and really showcasing what we do in this region and helping other areas of the world to treat their residents in the way that we'd like ours to be treated. So we run lots of events. I think a lot of you around the room have been to our events, and we thought we ought to rationalise some of those events and be really focused on what we were going to do. So for the business plan going forward, we focused on key events in different areas and where we thought we could make a difference and really reward the innovation in the region. And one of the things that we're conscious of is that innovation often isn't recognised. So can we do across our region all the things that we can to get people up there, showcase what they're doing, reward them for their hard work, and we thought we would just run these events. Now over the next 2 weeks we're running 4 events on top of these, so our plan of rationalising a bit really hasn't worked, but actually I think what we've recognised is that these events are so valuable for showcasing innovation but also for getting people together. So you will see us running these events, but we will probably do some others as well, and we are recruiting extra staff to enable us to do that, so hopefully we'll see you at a lot of our awards and winning them. So I think that's all I'm going to say. Happy for people to sort of come and give me comments on the business plan. We have sent it off to NHS England, but for regional purposes we can tweak it if we need to, if there's something you think we've missed. So I hope today goes well. Topic I think that's close to all our hearts about how we enable people to look after their own care, and I shall hand over to Brian.